Picture this. You're lying in bed at 3 a.m. and your feet feel like they're literally on fire. You throw off the covers desperate for relief, but nothing helps. Or maybe it's different for you. Maybe it's your hands that feel like 1,000 invisible needles are stabbing you constantly. You've mentioned it to your doctor. They smiled, patted your shoulder, and said those two words that make your blood boil. It's just age. But what if I told you they're dead wrong? What if the real reason your nerves are dying has nothing to do with getting older and everything to do with something hiding in plain sight? Something so preventable, so fixable, that when you learn the truth, you'll be furious. Nobody warned you. And here's the part that should terrify you. The pills you're taking every morning to stay healthy might be the very thing killing your nervous system. I've sat across from thousands of patients who walk into my clinic believing a lie. They think their nerve pain is permanent. They've accepted it as their new reality. They're wrong, and I'm about to prove it. Inside your body right now, there are 45 miles of nerves. 45 miles. That's enough wiring to stretch from New York to Philadelphia. These nerves let you feel everything. Your partner's touch, your grandchild's hug, the ground beneath your feet when you walk. Each nerve is wrapped in a protective coating called myelin. Think of it like the rubber insulation on electrical wires. When that coating starts crumbling, everything goes catastrophically wrong. Signals misfire. Pain receptors go haywire. Your brain receives garbled messages that it interprets as burning, stabbing, shocking sensations. And once that process starts, it doesn't just stop on its own. This condition has a name: peripheral neuropathy. Right now, over 20 million Americans are suffering from it. That's 1 in every 16 people. Someone in your family probably has it. Maybe it's you. But here's what makes me angry enough to make this video. Most people battling this nightmare have no clue that a simple vitamin deficiency is destroying their nerves. And the truly evil part, the medications your doctor prescribed, the ones you trust, the ones you take religiously because you want to be healthy, are draining this life-saving nutrient from your body every single day. Let me show you exactly how this trap works. You visit your doctor, your blood sugar is high. They write you a prescription for metformin. It's the most prescribed diabetes drug on planet Earth. Over 150 million people take it. You trust your doctor, so you take it faithfully. But you also have heartburn. Modern life, right? So you're also taking omeprazole or another proton pump inhibitor. Perfectly normal. Millions of people do exactly this. Here's the trap. Nobody explains metformin blocks vitamin B12 absorption in your intestines. Studies prove that between 10% and 30% of metformin users develop B12 deficiency. Some research suggests it's even higher. Meanwhile, your heartburn medication is reducing the stomach acid you absolutely need to extract B12 from food. You've created a perfect storm. Your body is being attacked from 2 directions simultaneously. But wait, it gets darker. If you're over 60, your stomach naturally produces less acid anyway. Aging has already weakened your defenses. Add in a plant-based diet, which contains virtually zero B12, and you're not just at risk. You're walking into a nutritional catastrophe with your eyes closed. Your body is screaming for this vitamin. Every cell in your nervous system is desperate for it. But every single factor in your modern life, the medications, the diet, the aging process, is blocking it. And here's the nightmare that keeps me up at night. By the time you notice the symptoms, you may have already suffered irreversible damage. That tingling you keep ignoring, that's not minor. That's your body's emergency broadcast system. That's your nerves sending up flares before they die. The numbness you're experiencing today could be the early warning of permanent disability tomorrow. I've seen patients lose their ability to walk. I've watched people lose their independence, their dignity, all because they waited too long to address something completely preventable. So what is this miracle nutrient that could save you? It's called vitamin B12, and its story is absolutely fascinating. Let me take you back to the 1920s. Doctors were terrified of a mysterious disease they called pernicious anemia. Patients would become deathly pale, weak, and develop horrifying neurological symptoms. It was always fatal. No exceptions. Then 3 researchers stumbled onto something incredible. They started feeding dying patients raw liver. I know it sounds disgusting, but these people came back from death's door. They literally rose from their deathbeds. The scientific community was stunned. Those 3 researchers won the Nobel Prize in Medicine in 1934. But they still didn't know why it worked. It took another 14 years before scientists finally isolated the magic ingredient hidden inside liver, a complex, brilliant red molecule with a cobalt atom at its core. They called it vitamin B12 or cobalamin. Another Nobel Prize was awarded just for figuring out its structure. Think about this. One tiny molecule was so important to human survival that it earned 2 Nobel Prizes. But why? What makes B12 so absolutely critical? It's the master electrician of your entire nervous system. It performs 2 jobs that literally keep your nerves alive. First, B12 powers something called methylation. During this process, it transforms a dangerous amino acid called homocysteine into a beneficial one called methionine. When this system works, your body manufactures a compound called SAMe, which is essential for building and repairing myelin, that protective coating around your nerves. Without enough B12, homocysteine accumulates to toxic levels. It's like poison flooding your nervous system, destroying nerves while simultaneously preventing any repair. Second, B12 is absolutely vital for energy production inside every single nerve cell. Each cell contains microscopic power plants called mitochondria. B12 is the fuel they need to function. Without adequate B12, specifically in its active form called adenosylcobalamin, these cellular power plants start failing. When they fail, a toxic substance called methylmalonic acid builds up. This acid doesn't just sabotage energy production, it actively damages the myelin structure itself. Do you see what's happening? B12 deficiency doesn't just attack your nerves from one angle. It's a devastating 2-pronged assault. It prevents repair of the protective coating while simultaneously poisoning the nerve from the inside out. Your nerves are being strangled and poisoned at the same time. That's why the symptoms are so severe. That's why people experience such excruciating pain. That's why early intervention isn't just important, it's absolutely critical. Wait too long and the damage becomes permanent. But here's where hope enters this dark story. If you've recognized yourself in what I'm describing, there's a clear path to recovery. But you need to be strategic. You need to be informed because even the testing process is designed to fail you. Step 1, get the right tests. Don't just accept a standard B12 blood test. This is critical. Many laboratories consider anything above 200 pg/ml is normal. That number is dangerously, catastrophically low for optimal nerve health. I push for levels above 450 to 500 pg/ml, but even that's not enough. You need to demand these tests. Methylmalonic acid, abbreviated as MMA, and homocysteine levels. When these markers are elevated, it's a blazing red alarm that your cells are starving for B12, even if your basic blood test looks acceptable. These functional tests reveal what's actually happening inside your cells, not just what's floating around in your bloodstream. This distinction could save your nervous system. Step 2, choose the right form of B12. Pay attention here because this is where most people get scammed. Walk into any pharmacy or health food store, you'll find cheap B12 supplements everywhere. They contain something called cyanocobalamin. This is a synthetic form that literally contains a cyanide molecule. Yes, cyanide. Your body has to work incredibly hard to strip off that cyanide and convert cyanocobalamin into forms it can actually use. Many people, especially those with genetic variations, can't do this conversion efficiently. They're wasting money on supplements that barely work. What you need is methylcobalamin. This is the bioactive form your nervous system uses directly to repair damaged myelin. Even better is finding a combination supplement that contains both methylcobalamin and adenosylcobalamin. This attacks the problem from both critical angles, myelin repair, and cellular energy production. Hydroxycobalamin is another excellent choice your body easily converts. Step 3. Delivery method is everything. This is where many people sabotage themselves without knowing it. If you have absorption problems, and let's be honest, if you're over 60, taking medications or dealing with digestive issues, you absolutely do, then swallowing pills is basically throwing money away. The B12 will pass right through your system without being absorbed. You need sublingual forms. These are tablets or liquid drops that dissolve under your tongue. They bypass your entire digestive system, going directly into your bloodstream through the mucous membranes in your mouth. For severe deficiency or active neuropathy, intramuscular injections are the absolute gold standard. They deliver 100% of the therapeutic dose exactly where your body needs it. I've watched patients experience dramatic, life-changing improvement within just weeks of starting injection therapy. The transformation can be shocking. Step 4. Dosing for real results. Maintenance dosing is one thing. Fighting active nerve damage is another. For general maintenance, 100 micrograms daily is typically adequate, but if you're actively battling neuropathy, if you're experiencing symptoms right now, you need therapeutic doses. Anywhere from 1,000 to 5,000 micrograms of methylcobalamin daily for a minimum of 3 to 6 months. Research has definitively shown that 1,000 micrograms of methylcobalamin taken daily produces significant, measurable benefits in diabetic neuropathy patients. Their pain decreases, their nerve conduction improves, their quality of life transforms. Step 5, the supporting cast. B12 doesn't work in isolation. It needs specific coactors to reach its full potential. Vitamin B6, but only in its active form called P5P, works alongside B12. Folate, specifically as methylfolate, not synthetic folic acid, is essential for the methylation process. Vitamin B1, especially in a specialized fat-soluble form called benfotiamine, has shown remarkable results, protecting nerves from high blood sugar damage. If you're diabetic, this is crucial. Magnesium acts as your nervous system's natural voltage regulator. It calms overactive nerves that are sending false pain signals. And then there's alpha-lipoic acid, abbreviated as ALA. This is a uniquely powerful antioxidant. It's both water-soluble and fat-soluble, which means it can protect every single part of your nerve cells inside and out. Multiple clinical studies have demonstrated that 600 milligrams of ALA taken daily significantly reduces pain, burning sensations, and numbness in diabetic neuropathy patients. Step 6. Food is your foundation. While supplements correct existing deficiency, food provides your long-term foundation. The richest sources of B12 are exclusively animal-based. Liver and organ meats contain the highest concentrations by far. Shellfish, especially clams and mussels, are incredibly rich sources. Fatty fish like wild-caught salmon and sardines, grass-fed beef, pasture-raised eggs, and quality dairy products all provide substantial B12. If you follow a plant-based diet, supplementation isn't a nice option. It's absolutely mandatory for your survival. And please don't fall for the dangerous myth that spirulina or chlorella provide usable B12. They contain B12 analogues that don't function in the human body and can actually interfere with real B12 absorption and blood testing. Here's what you must understand. Nerve damage is often completely irreversible once it crosses a certain threshold. The time to act isn't next month. It isn't when symptoms get worse. It's right now, today, before you permanently lose sensation in your feet or fall and shatter your hip because you've lost your balance. That burning sensation you're experiencing isn't just uncomfortable or annoying. It's your body's emergency alarm system at maximum volume, screaming that something is catastrophically wrong. B12 deficiency is a silent epidemic sweeping through our population. But unlike cancer, unlike heart disease, unlike most health conditions, this one is preventable, identifiable, and completely treatable. Your nervous system possesses a remarkable, almost miraculous capacity to heal itself when given the right tools. I've personally witnessed patients who could barely walk across a room regain full mobility. I've watched people who hadn't slept through a single night in years finally get relief from the relentless burning pain. But every single one of them had one thing in common. They took action before crossing the point of no return. If this information has opened your eyes, I need you to do 3 critical things immediately.